Good morning all. Myself Sheena Marin Thomas. I'm working as an assistant professor in College of Pharmaceutical Sciences, Dayanand Saga University. Today I would like to take a lecture on the topic community pharmacy and the management of community pharmacy. Now I would like to share the PPT for the same. So, first of all, I would like to begin the lecture by giving the definition of community pharmacy. Community pharmacies are nothing. These are privately owned establishments which mainly contains both prescriptional products as well as over-the-counter drugs. And these kind of pharmacies should be always under the supervision of a legally qualified pharmacist. The next term which I would like to introduce is community pharmacists. Community pharmacists are nothing but legally qualified pharmacists. They should either hold a diploma or a degree in pharmacy, and they should be actively involved in the dispensing of both prescriptional drugs as well as over-the-counter drugs and other activities such as manufacturing of drug products, providing counseling or information about the drugs to the patients as well as to the healthcare professional. In the current topic, that is community pharmacy management, I would like to include the following things. So my contents include, for the successful management of a community pharmacy, first thing is a proper selection of site, space layout and design is very important. Next one is the selection of staff and materials, the legal requirements which has to be maintained in the community pharmacy, the various registers which has to be properly followed in community pharmacy. Next one is the use of computers and other kind of softwares and its usage in community pharmacy. First one, the selection of site, space layout and design. While selecting the site for community pharmacy, we should always keep in mind the following points. That is, it should be near to a clinic, which we have selected for starting a community pharmacy should be most suitable among the different pharmacies which are available in that particular area. It should be convenient to the customers and easily accessible. Free parking facility is one of the other parameter which has to be kept in mind. Next one is, and there should be proper waiting area inside the community pharmacy so that the movement of customers inside the pharmacy can be reduced. Next one is, if we take community pharmacy, two types are there. It can be either a retail community pharmacy or a wholesale community pharmacy. What are the objectives while designing the community pharmacy? First one is, the objective should be kept in mind is we should be able to attract a large number of customers, which in turn helps in increasing the sale of the store and will bring profit to the community pharmacy. Next one is, we should always keep in mind the customer satisfaction should be given the most important, the prime importance or the most importance. There should be sufficient space for office of chief pharmacist, for storage of drugs and for keeping the drugs on the racks, as well as proper resting place should be there for the employees. A proper entrance is another thing which is very much essential while designing a community pharmacy. It helps in increasing the entry of customers into the pharmacy. Next one is, the pharmacist who is working in the community pharmacy should always a project professional image. He should wear a white coat as well as he should be neat and clean while he presents himself to the customers who are coming to the particular pharmacy. Next one is, the movement of customers within the pharmacy can be minimized by providing them sufficient waiting area where the customers or the patients can come and wait. Next one is, what all are there in the community pharmacy? It mainly consists of a proper dispensing area where the medicines are stored and dispensed. A proper qualified pharmacist should be present all the time. To help that qualified pharmacist technicians should be available, sufficient number of pharmacy technicians, and the owner of the pharmacy under whose name the license will be registered should be a legally qualified pharmacist. Then apart from that, we need sufficient number of personals, that is sufficient number of pharmacy staffs and technicians are available. Proper buildings or proper areas is needed for starting a community pharmacy, for showing the dispensing area, storage area, counseling area, and for the manufacturing area. There should be sufficient equipment so as to measure the blood pressure like sphygmomanometer, or to measure the blood sugar, glucometer should be available. Finally, all community pharmacists should be able to tally whether they are running in profit or loss. For that, proper documentation and information has to be provided, like how much quantity of drugs has been purchased to the community pharmacy and how much quantity has been sold to the patients. Next one is the dispensary area. It's very important. It usually determines the communication between the patient and pharmacist. It should be spacious, and there should be sufficient space where the pharmacist can sit and give counseling to the patient. And apart from that, proper area for dispensing also should be made, and it should be clean and neat. All community pharmacies should be open or should be designed in such a way that they should fulfill the legal requirements specified in Schedule N of Drugs and Cosmetics Act. Schedule N is nothing but it specifies the minimum facilities or requirements for starting a community pharmacy. According to Schedule N, a retail community pharmacy should have a minimum area of 150 square feet. Similarly, a wholesale community pharmacy should have a minimum area of 200 square feet. So this is the diagrammatic representation or the outline or the design for a retail community pharmacy or a wholesale community pharmacy. Here you can see the differences between the retail and wholesale community pharmacy. The main difference is the dimensions or the area. A retail community pharmacy should have a minimum area of 150 square feet, and a wholesale community pharmacy should require a minimum area of 200 square feet. Apart from that, more number of racks as well as waiting area and tables and chairs can be seen in wholesale community pharmacy. And comparatively, these kind of things like racks for keeping the medicines, the waiting area for where the customers can come and wait for the medicine, the display window, everything will be less in a retail community pharmacy. And both, whether it is a retail or a wholesale community pharmacy, a proper entrance is very important to attract the customers, as well as the pharmacist who is working should project himself in a professional manner. Apart from that, storage of drugs, for storing of drugs, separate areas needed, and for some kind of drugs we have to store in freezer or the refrigerator. So the presence of refrigerator is also very important for a community pharmacy. Next one, once we have designed the site for the community pharmacy, next one is the selection of staff and material. So while selecting a particular staff for working in a community pharmacy, different steps are involved. One is selection of the staff, giving proper orientation to the staff. Then, while selecting the materials to the community pharmacy, we are usually following two methods. One is coding of the particular product. Next one is stocking of the particular product. We will start with the selection of staff. Always, the pharmacy manager will be responsible for selecting the particular staff to the community pharmacy. So they should be properly qualified. Overhiring should not be there. That is, superiorly qualified people should not be selected for doing inferior jobs. Similarly, inferiorly qualified staff should not be allowed to work for a superior job. Then the pharmacy manager as such has certain duties while selecting a particular staff for community pharmacy. One thing is he should design an application form, and he should make a job description which should specify the nature of the job, so that the candidate who is coming for the post of pharmacist can read and understand what all things he has to do in the community pharmacy. And accordingly, proper promotions are also available or also needed for the pharmacy staffs who are working in a community pharmacy. Then another function of pharmacy manager is maintaining of availability file. Availability file is a record of qualified people who have sent the CV or biodata for a particular job. So if we are maintaining such kind of file, whenever a vacancy comes, we can refer or go through the file, Then the manager of the pharmacy should design an application form, and all the policies and procedures should be according to the laws, according to the different federal and state laws. And compensation is a very important thing for retaining good employees. We should provide different kind of insurance policies, different kind of leaves has to be provided, vacations, casual leaves, maternity leaves, earned leaves should be provided so that we can retain good employees in the community pharmacy. Orientation of the staff. Orientation should be done on the following things. First thing is basic goals and philosophy of the pharmacy, or the vision or the vision and the mission of the pharmacy should be properly explained to the candidate. What is the duration of the lunch break? During weekends and during holidays has to be properly told. Any kind of overtime rules are there? If overtime, if the pharmacist is doing any kind of compensation is there, then what are the safety and security regulation regarding vacations, leaves, how he can apply? What is the personal telephonic usage which he can do in a day? And all these things has to be properly explained so as to increase the productivity of the community pharmacy. Training is usually done by two methods. One is swim method and another one is sink method. So in sink method, it is nothing but the person or the newly joined staff is simply put to work, and he has to observe his seniors or his colleagues how they are working in the community pharmacy. By observing by himself, he has to study all the things. There won't be any kind of proper training. Everything the candidate has to study himself by means of observation. Opposite is swim method. In swim method, the newly joined staff will be put under the supervision of a trained pharmacist. So this trained pharmacist is considered as a mentor for this newly joined staff, where he will properly explain what all things has to be done in the community pharmacy. So by means of this training, the newly joined staff will be able to attain knowledge about the functioning of the community pharmacy. Next one is the selection of material. Coding is nothing but it's a process of assigning a code or symbol for a particular drug, which helps in easy identification of the product, as well as it helps in maintaining a good system of storage of product. Stocking is nothing but we should always keep the drugs or other commodities in the community pharmacy in such a way that over storage should not be there, which leads to wastage of the product, or under storage should not be there, so that customers should simply go from the pharmacy without buying the particular drug. So the storing proper quantity of drug is very important in a hospital or community pharmacy, and this stocking is usually based on certain kind of inventory control methods like ABC analysis, VED analysis. Next one is what are the legal requirements for starting a community pharmacy? For purchasing as well as maintaining certain kind of drugs, we need general license, and for some other products which are little bit more sensitive, we need restricted license. So what are the conditions or who can apply for general license and restricted license? So those pharmacists who are having a proper area or premises for starting or carrying out a business of pharmacy should only apply for general license. And one more thing, he should be a registered the owner of the pharmacy should be a registered pharmacist, then only he can apply for general license. And the license which the pharmacist is having or the owner of the place is having, it should be displayed in a prominent place so that customers can easily view the particular license. And all the drugs which are purchased in the community pharmacy should be according to Drugs and Cosmetics Act and rules. And two other things which are very important is, once you have selected all the staff for the community pharmacy, in case if any change in the staff is there, or a new staff has been admitted, or an old staff has been removed from the job, so such kind of things has to be properly updated to the licensing authority within 1 month. And the last one is, if any kind of drugs belonging to Schedule C and C1 are stored in the community pharmacy, it has to be properly informed to the licensing authority. So Schedule C and C1 mainly contains vaccines. Restricted license is also same. In order to get restricted license, they should have proper premises to carry out the business of pharmacy, as well as a legally qualified pharmacist should be the in charge for the particular pharmacy, and here all the drugs should be sold in the original container, and the drugs has to be purchased from a licensed manufacturer. Proper area is needed for proper storage of drugs, and it should comply, all the drugs purchased should comply with the provisions of Drugs and Cosmetics Act. So next one is the various registers which has to be maintained in community pharmacy. So these registers can be divided into three: legal registers, patient records, as well as financial records. Legal records are nothing but all the drugs which are maintained in the community pharmacy. Their how much quantity has been purchased and how much quantity has been dispensed to the customers. So that remaining how much will be there in the community pharmacy. And here also specific records has to be maintained for habituating drugs or habit forming drugs like narcotics, anticonvulsants, hypnotics and all. And if these kind of records are not properly updated, the pharmacist or the owner of the pharmacy will be in a position to pay the fine for the same. Patient record is nothing but those patients who comes to the community pharmacy, their details has to be mentioned, which includes patient demographics, their name, age, sex, address and all. Then the past medical and medication history, for buying which drug they came to the community pharmacy, whether they have any kind of side effects or allergic reactions in the past, and these kind of things has to be properly mentioned, as well as about the drugs, which all drugs has been given to the particular patient, the dose of the drug, all those things has to be properly mentioned. Next one is financial records. Financial records is nothing but it is mainly done to ensure whether the pharmacy is running in profit or loss. So they have to tally how much amount of money has been received in the pharmacy, as well as how much amount of money has been spent from the pharmacy, and in the end of the annual year whether the pharmacy is running in profit or loss. So these are legal record details. All the drugs has to be maintained according to federal and state laws, as well as based on Drugs and Cosmetics Act. Proper records has to be maintained regarding acquisition and disposition of drugs for abuse, poisonous and hazardous substance. If it is not properly maintained, penalties has to be paid. Patient records regarding the patients who are coming to the community pharmacy, their allergies or idiosyncrasies and all, food related allergies, all the details has to be mentioned. Financial records are nothing but it has to be updated because it helps in efficient management of community pharmacy, as well as to take proper decisions regarding the future need for the money or inventory requirement, or many other staff has to be included, or any other expansion of facilities. Next one is the usage of computers in community pharmacy. Nowadays, everything, all the information. Nowadays, all the informations related to patients or related to drugs has to be maintained in the softwares in community pharmacy, and these softwares mainly helps in systemic functions, managerial function, professional function, clinical support, as well as in accounting and business management. In the systemic function, it helps in the preparation of prescription, providing receipt for the patient, calculation of total prescription cost, or generation of copies related to transactions. The managerial function mainly includes preparing the daily sales report, the sales report for a particular week, as well as analysis of the sales and the financial report. Professional is nothing but maintaining or storing information related to drugs as well as related to patients. These patients, whether they had any allergic reaction, whether any kind of drug-drug interaction or drug-food interaction, as well as which physician has been mentioned in a particular prescription. This physician's name, address, contact number has to be properly mentioned, because if the patient is suffering any kind of interactions, it has to be reported back to the physician. Clinical support regarding software is we can provide make patient counseling materials for the patients by means of computers and softwares like brochures, pamphlets and all, which will be helpful for the patient in understanding the drugs and disease condition. And last one is these kind of computers and softwares are also helpful in accounting and business management. So these are the references on the books which I referred for making this PPT. Thank you.